From the News Channel 8 studios, let's talk live with your hosts, Natasha Barrett and Doug McKelway.
Welcome to this Friday edition of Let's Talk Live.
It's Friday. I'm so happy.
Oh, isn't it nice?
I have to really quickly tell you a funny story.
Okay.
I was in the grocery store last night, and quick story, I promise. This lady came up to me, and I never get recognized from the news. Shut up. And she said, "Oh, don't you work at Channel 7?" And I said, "Yes." And she goes, "Don't you work for that Doug McKelway guy?"
Yes, she
and
does.
I paused. I said, what am I going to say here? I said, well, if you asked him, he would probably say that. So she's a big fan.
Oh, well, that's nice.
She's about 72, but she loves you.
That's my greatest, fan pool right there.
And I am glad to have a job, Doug McKelway.
Okay, thank you. Just behave, okay?
She was so cute.
You better
behave.
behave.
So cute. Well, millions of people struggle with addiction every day, and most people don't know how to fight it.
Well, sometimes people just need a helping hand to take them from addiction to recovery. And who better to tell them about it than Dr. Anita Gadhia-Smith, who has written her book, From Addiction to Recovery. Thank you so much for joining us today. I'm fascinated by your story because not only are you a psychotherapist, but you have been there. If there's a substance to have abused, according to what I've read in your book, you have abused it in your life.
Yes.
Right?
I started abusing substances when I was about 12 years old. Went through active addiction for about 15 years. Got into recovery when I was 27 years old, and now I've been in recovery for 19 years. And very, very soon after getting into recovery, I became a psychotherapist. I practice in Georgetown and Bethesda for the past 10 years, and a couple of years ago I did write my book called From Addiction to Recovery, which chronicles the addiction but chronicles even more the recovery process and the challenges that people encounter in living a sober life and how to navigate through relationships and finding meaning and a career and how to construct a meaningful life in sobriety.
Now, is your history of addiction something that you confide in your patients as a psychotherapist?
I do at times if I feel that it will be helpful to them to know. Very often people who are struggling with the same issues feel more trusting if they know that you understand. So while it's not something that I would talk about with everybody, if I think it's going to be helpful, I do disclose that.
How at just 12 years old did you have such access? How did you get your hands on? What were you addicted to? What did you try?
It started out with alcohol and marijuana and then went on into other drugs. Pretty much everything that you can think of.
How did you get that at 12?
It was pretty easy, actually. Well, I was 12 in the early 70s, and, there was a lot going on then, and it was readily available, although I went to a small private Quaker school called Friends, and, it was a very small community, but there were other kids that I met outside of school that had a lot of access to things, and I think we always find what we're looking for. And
exactly, and there's no boundary between children who are well off and at the good schools and those who are not so well off. In fact, there's a sort of a running joke about the kids who are at exclusive private schools that they have more money to get the better drugs or alcohol in some cases.
Get into more trouble.
To get
more
trouble,
access.
Maybe, but literally, I mentioned off the top that you went through the gamut: alcohol.
Yeah.
Painkillers.
Yes.
Heroin.
Yes.
Even everything.
Cocaine.
And you lived half your life being oblivious to the world around you.
Yeah, 15 years.
15 years.
Yeah.
Were you ever tempted, or to this day, are you ever tempted to try something again?
In the last 19 years that I've been in recovery, there have been some times when I was tempted, but I never felt the compulsion to act on it. And I think that the reason is that throughout the last 19 years, I have continued to work on myself and my recovery and to continue to ask for help when I need it, which is really the key to being able to stay on track. In my practice, I work with adults and adolescents and individuals and couples, and You know, they come for a variety of reasons with lots of issues. Sometimes they themselves want the help. Other times it's a family member or a legal problem or some other school problem that has brought them to the point of seeking help. But whatever the case may be, anyone can recover from anything at any time by getting help.
But at the same time, you know how insidious addiction is, and
yes.
how it comes back to bite people who have, in some cases, been in recovery or without drinks or drugs for years and years and years. Are you aware of that dynamic, and what do you do when it strikes, when that impulse to reindulge strikes?
Well, with people that I work with, if they feel that coming, let's say someone has been sober for a long time and feels themselves slipping back, reaching out for help and talking about it kind of takes the steam out of what's going on, and then it can be turned around. As long as you don't take the first drink or drug, it's possible to come back and turn things around.
The other thing I found really fascinating about your story is that despite these terrible addictions, which were really consuming you, you were able to function at a really high level. You were going to college, getting good grades, taking difficult courses,
yeah.
passing all the way through.
Yeah, I went to Johns Hopkins University, and I guess I would have been considered a high-functioning addict at that time. But then what happened later was that as other people my age went on to develop careers and have families and all of these sorts of things, I decided to just live in my addiction. And, you know, I couldn't really progress. I got stuck until I got into recovery.
Bringing it full circle, since you started this at 12 years old, right now is a scary time for kids. I mean, I've talked to my stepkids, they get offered weed in school. And for them to tell me that, it makes me want them to take them out of school and homeschool them myself. But that is what's happening in schools everywhere. How can a parent shield their daughter, their son, without, you know, wrapping them in bubble wrap and taking them home?
That's an excellent question, and I do work with a lot of adolescents and a lot of college students as well, and I see alcohol and drug addiction as well as internet addiction and even sexual addictions in these age groups, and usually something happens somewhere that gives the parents a clue that there's a problem, and it's very important for the parents to intervene and try to get help for the child while they can, because at a certain point when the child is gone, there's not much more they can do.
Right.
But while they can, it's important to do everything they can.
Doctor, we are flat out of time. We could talk all day about this, but for people who are interested, the book is called From Addiction to Recovery by Dr. Anita Gadhia-Smith. Thank you so much.
Thank you.
Your knowledge you impart is hugely valuable to a lot of people.
Thank you for having me.
Thanks for sharing it. Coming up here on Let's Talk Live, who should pay the price when parents fail behind or fall behind on bills? Some school districts are punishing kids for their parents' mistakes. We're going to weigh in.
And send your questions and comments to Let's Talk Live at news8.net. We want to know what you think, but first, where did you get that outfit you're wearing right now?
Aunt Taylor, Christmas present, Tarjay, BCBG, everything else, Marshalls, TJ Maxx.